All right, who is ready to talk about dicks? Yeah. All right, so my name is Sun. GM everyone, thank you, Paul and BioProtocol, to hosting such an amazing event. My name is Sun. I'm from Thailand. I'm a medical doctor, and I'm also a co-founder of DickGPT by DickDAO. So let's talk about DickGPT, right? DickGPT is the bioagent that make your dick stronger. So let's talk about dick problems. So as I believe all of you heard the panel between Paul and Arthur Hess, he mentioned that dick issue is really important and is global issues, right? So let's look at the numbers. There are 4 billion men globally, and 4 out of 10 men have one of the men's sexual health problems, such as erectile dysfunction, premature ejaculation, maybe you have low sperm count, so you have male infertility, and someone have low testosterone level. And all of these problems are categorized in the medical world as benign urologic condition. Benign means good, right? So these problems mean good urologic condition means that even if you have this problem, you are not actually sick. If you have a low sperm count and you cannot have a child, you are not actually sick. You can work, you can get on with your life, you can function well and even normally. If you have erectile dysfunction, right, you are not actually sick. You are not just perform very well in bed, but you're actually fine. This is the perspective of current medical world, how they view men's sexual health issues. So for all these reasons, men's sexual health receive less than 1% of the total NIH funding. And last I checked, in the 2025, men's sexual health received 0 funding from the NIH to fund men's sexual health research, which is I think is absurd. And lastly, all of us, I believe in the numbers, right? So we have a lot of men in this room. And I believe almost 50% of you guys have some type of men's sexual health issues. And all of you, I think, believe once you have go through and search in the internet to find solutions. Because, and all of you, I believe a small proportion of you guys don't actually go to doctors or urologists to actually try to seek professional or medical help for all these issues. Why? Because these issues, right, are very stigmatized and very taboo. You don't want to talk about this problem with your friends. You don't want to talk about this problem with your doctors or your families because it's embarrassing. It's embarrassing to tell that I cannot last long in bed. It's embarrassing to tell your girlfriend or your friends that your dick is soft, your dick is not hard at all. You cannot maintain erection during sexual intercourse. But these problems are important, and I believe sexual health is one of the important aspects of everyone's lives. So this problem is really important. So the solution that we came up with is to provide, so we are not trying to force all of you guys to go to doctors and seek professional help, because that's not how this works, right? But instead of trying to force everyone to seek doctors, we are trying to create the tools that encourage everyone to use it and to try to find a science-backed solution that is personalized and that can guide you towards your peak performance in men's sexual health. So first thing first, we're trying to build a personalized care that can personalize mean that you can have someone who can actually understand what's your problems, what's your status, what's your budget to maintain your health, what's your availability and time resource that you can allocate to adopt new lifestyle to optimize your health, and also how much can you invest in supplement and medications. So you need someone who understands this. The second one is to accelerate cure discovery and reduce research costs, because as I showed you in the previous slide, we don't receive a lot of funding at all. We receive no funding from the NIH to fund men's sexual health research. So we need to make it super effective, super efficient, and very, very, very cheap. And lastly, I think the most important part of what we are building here is to break the stigma, right? I think it's really important to build a tool that I personally want to use, and you guys here want to use it to find answers, to find solutions of all your problems. Not just a tool that you can use once and then that's it. I think we want to build a tool that actually suitable for everyone and accessible for everyone. So DigGPT, I think, is the answer for all these problems. I want to talk about 3 core features that we offer to the men's health industry. The first one is really interesting. The first one is called DH. DH is short for dick age. In the other word is how old your dick is, right? So right now people are really obsessed with aging, right? And we have age for everything. We have brain age, we have cardiovascular age, we have your pulmonary age, we have your liver age, and you combine all of this to try to determine what is your biological age versus your chronological age. So we adopt the similar metrics and invent this DH to be able to tell how old your dick is compared to your chronological age. So from this perspective, you can see that peak performance of men's sexual health are actually under 25. So if your DH is between 18 to 25, that's your peak performance is. And if your DH is older than your chronological age, for example, I am in my late 20s, my DH is actually a couple years older than my chronological age. So my goal is to reverse it with using DigGPT as my companion. And also there's a QR code beside the title. You can actually scan it and try to find how old your dick is right now. But right now we are optimizing it to our DigGPT engine. So you can you have to go through a login wall. But if you are fine with that, you can try to determine your DH right now. And I think it's really important metrics because these features allow every man here to assess how old your dick is, assess your mental health status as of right now, and also track your progress over time as well. And also with this, not only is a consumer-facing features, it's also a researcher and scientist-facing feature as well, because we have a tools to collect and analyze data, and the data is verifiable and trackable. So this tool is one of the most promising tool and research infrastructure to accelerate men's sexual health research, and I think it's really important. And actually, our feature is live in our website, digdow.xyz, and right now we have incentivized more than 12,000 Web3 community to assess their DH. And in one DH, there is 5 medical questionnaires there's 5 medical questionnaires in one DH assessment, and we cross-reference the scoring and result with the age group preference, and calculated all the framework and train it into DigGPT engine, so it able to calculate your exact DH. So in less than a week, DigGPT engine analyzed more than 50,000 medical assessments in the Web3 community. I think this number is really impressive, and this is already more than what hospital can assess in a year for men's health industry. Another 2 features that I want to talk about is personalized recommendation and 24/7 Dig Knowledge. These are the live sessions that I had with DigGPT during the week. There is a QR code on the bottom right corner. I'll stand here so you can scan the QR code. So you can access to my full conversation and go along and cross-check all the reference that we provided. So the first prompt that I asked DigGPT is to build my personal recommendation to increase my testosterone level from lifestyle modification to supplement and when to seek professional help. What I want you to see is that DigGPT is not only answer all these questions accurately, it can provide, it can actually say that most T boosters are not really effective, which is really true. Especially in those who have normal or sufficient testosterone level already. These supplements are not as effective, and this the DigGPT knows about this. And they also provide evidence and citation to the source, to the meta-analysis, and to every available evidence out there, so you can cross-reference and you can trust that the data is super reliable and have a lot of evidence backing all these answers. The second question, I turned myself from being a patient into being a doctor. I input some of my patients' history, risk factors, standardized medical tests, lab results, semen analysis even, and also blood works. And I prompt DeepGPT to analyze all these results and diagnose, analyze, and give the patient what's the next step that he should do. And this is the full answer. So as you can see, there's a QR code if you want to see it in details. As you can see, right, DeepGPT is able to analyze every result accurately. And I think the most important part is DeepGPT understand that in order to analyze medical standardized tests like this, you cannot only use numbers. You have to cross-reference with medical history and risk factor. I want to point out that in the past, the result that I provided, one of the tests called Adam test was positive, meaning the patient is positive for have a risk factor for low testosterone level, but DeepGPT was able to cross-reference the positive Adam test result to his history, the history taking that I provided, and came to a conclusion that these patients are not at risk, or his hypogonadism risk factor is not that high, because even the test result is positive, he doesn't actually have symptoms of hypogonadism. So the main diagnosis and main problems of the patient is low sperm count, vitamin D deficiency, and erectile dysfunction. And then DeepGPT process to provide a very accurate recommendations for this patient with urologist referral, correct the deficiency for the vitamin level, and also lifestyle overhaul, which is really accurate. And this is what exactly myself and my urologist friend would recommend to the patients. So this proves that not only DeepGPT is a companion for every man, it also can help doctor like myself or other doctor to analyze results faster and more efficient. And in order to achieve these impressive results, I think one of our moat and one of our strong points lie into our database. We developed our own knowledge graph with urologists curated from medical textbooks, guidelines, meta-analysis, RCTs, and available studies out there regarding men's health and men's sexual health. Right now, we have over 600 data points that we aggregated into the database to train DeepGPT. And I think this is one of the reasons that I believe we are at the pivotal point where bioagents can overtaking traditional science. Because this is the first mover of the industry. There is no AI product out there that have this kind of database right now. This is the first urologist curated database that is used to train the AI agent. And I think being the first mover is really important and is a strong moat that we have, because as you may know from the previous panel, the knowledge graph is constantly learning and evolving. From every interaction that DeepGPT have with all the men out there or the users out there, it learns from every interaction and grows. And next step, we are going to host a new feature called community training the agent, so the community can come up or propose the papers, the proposal, the research that is interested, and our team will review, so that will make the training system and the knowledge graph grow much faster. Right now, we are at just over 600. We aim to be in the ballpark of 1,000 database within this year. So I think it's really important, and being a first mover is strong mode that we have for DeepGPT. This is another example that I tested out. So this showcases its ability to generate hypotheses. So DickGPT dived into the 600 plus papers and research and came up with the supplement that can be effective on improving erectile dysfunction, but still don't have enough studies or evidence. And it came up with Korean ginseng, which has been around forever, right? Since the old times. Like I grew up watching K-drama, and Korean ginseng is one of the most valuable supplements that is used in Korea. So it's really important, and I think it's really interesting that DickGPT is able to pick up this herbal supplement that has high potential for improving erectile dysfunction. So I asked the following question to generate a hypothesis and design an experiment. So it's proposed a hypothesis that the peanut ginseng can improve erectile dysfunction, and it designed the experiment to be a 3-arm randomized double-blinded control trial. So comparing, DickGPT want to divide the test subject into 3 groups. First one is the one with tadalafil, which is the first-line treatment for erectile dysfunction. And the second group is the placebo, and the last group is the group with Korean ginseng, and then compare the result afterward. And I think it's really strong. So this is the flywheel that we really want to make it happen. As you can see, DickGPT engine is able to generate hypotheses for novel treatment or supplements or cures for any men's sexual health issues. We want to be able to generate hypotheses, and our community will curate the hypothesis that has promising result or just a hypothesis that we are interested in. And our community will facilitate the IP minting via our partner, Molecule Bio and Pump Science and more. And then proceed to do a clinical trial, and then the successful trial will be commercialized into real products. And as you can see from our previous showcase, I think DickGPT has a very strong value proposition, right? From our database, from the ability to be able to answer hard questions, the ability to provide answer to men's sexual issue with science-backed answer and citable references. I think that is already very strong value prop of DickGPT. The next one is accelerating drug discovery. From generating hypotheses to data collection and analysis. Can you imagine if we are able to generate the hypothesis from DickGPT engine and process to mint an IP token, then go on with the clinical trial, and we use the DH feature to encourage and incentivize Web3 community to contribute their data to the research. And most of the research, if you saw in the prompt, the endpoint that DickGPT proposed is to use the IIEF scores, which is also included in the DH calculation. So DH will be a very strong infrastructure for data collection and analysis for men's health. So you can see that DickGPT is not only a consumer-facing bioagent, which is already like a big value and a huge market in this already, because consider there's 4 billion men out there, and just like assessing just 1% of the men's population is already $100 billion value added to the industry already. It also helps with drug discovery and data analysis and collection. And imagine that right now we have just over 12,000 Web3 community users that is existing for the DS assessment. Imagine what's going to happen if we have millions of user base for DickGPT. Imagine what we could do with that data. Imagine what we could do with the size of the community. I think this is very significant, and I think there's a lot of value added to the men's sexual industry for these features. So this is our roadmap. Our North Star goal is to be able to disrupt men's health, both the consumer-facing side, as I mentioned, and also the drug discovery in men's health. So we are starting this quarter, Q3. We are launching DickGPT agent via bioprotocol, and soon after the launch, similar to Aubrey AI, DickGPT agent will be openly promptable on X. So you can just tag DickGPT on X in a similar fashion like AIXBT, and it will be able to provide Dick knowledge 24/7. And then we are launching a lot of stuff. We are launching hypothesis on-chain. We want to do experiment on-chain. And then next year, we are planning to build a patient data hub. We mentioned that DH is a very strong tool to collect data and analyze data. And we want to make it verifiable and trackable so that we can integrate this data with research institutions and finally make it a proper data collection and analysis tool for mental health research. So the token launch is coming soon. We are live on the bioprotocol launchpad. There's a QR code you can scan and read everything about our projects in details. We have hypothesis, problem, solutions. We have our website, Twitter, and Discord here. Yeah, please check it out. And I think we are launching very, very soon. So super excited, super happy, and looking forward to the future of mental health. And yeah, this is so DigGPT was launched privately in our Discord with our existing community members, and we received very, very impressive feedback. There is a lot of recommendations generated in our Discord server, and we receive a lot of feedback from our community members so that we are able to use this feedback to optimize DigGPT even more. And right now, we are super, super close to the launch, and I'm really excited for everyone to be able to try out the DigGPT on Agent on X, on Discord, and on our chat terminal very, very soon. This is our team. We have 4 doctors in our team. So led by Dr. Jiori, he is a urologist from Thailand. We have a cardiothoracic surgeon, Dr. Ek, and myself, and also another doctor in our team. We also have AI dev, and also I believe that I myself, standing here in DigDAO team, as a medical doctor who is also Web3 native, I bridge both the benefit of science world to the Web3 world perfectly, and I think we can do a lot with this combo that we have here. And we also have our team members here in the event as well, wearing DigDAO t-shirts, so you can reach out and talk to them and ask questions, and I'll be around, so happy to answer anything. Yeah, so I believe DigGPT is the engine to accelerate men's health and disrupting longevity, but for your digs. Thank you.